The human body is built to protect itself. It heals, it adapts, and sometimes it hides things that should not exist. Doctors around the world have begun routine procedures only to uncover discoveries so disturbing they defy logic. These are not myths, they are documented medical cases. An elderly woman complained of abdominal pain and digestive issues. Scans revealed a large, calcified mass. Doctors soon realized she was carrying a lithopedion, or stone baby. Decades earlier, the woman had suffered an undiagnosed ectopic pregnancy. The fetus died, but the body could not expel it. To protect itself from infection, the body encased the fetus in calcium. It remained inside her for over 4 decades. Doctors described the discovery as extraordinarily rare. Fewer than 300 cases have ever been documented worldwide. A middle-aged man arrived at the hospital with worsening symptoms, persistent coughing, blood in his mucus, chest tightness, and difficulty breathing. Doctors initially suspected tuberculosis or lung cancer, but when imaging scans were taken, something unusual appeared. A rigid, branching structure embedded deep within the lung tissue. During a bronchoscopy, surgeons made a discovery that stunned them. Inside the lung was a living plant structure, a small tree branch, complete with offshoots. Years earlier, the man had accidentally inhaled a tiny seed while working outdoors. Instead of being expelled, it lodged itself in the lung's soft tissue. The lung provided everything the seed needed: warmth, oxygen, moisture. Over time, the seed germinated and began to grow. Doctors carefully removed the branch piece by piece, worried that disturbing it too quickly could collapse the lung. Medical staff later stated this was one of the rarest foreign body cases ever recorded. A man was rushed into the emergency room screaming in pain, sweating profusely, and barely able to breathe. His blood pressure was dangerously unstable. X-rays revealed a long, serpentine shape moving inside his body. Doctors realized they were dealing with something alive. During surgery, they found a live eel inside the patient. The animal was still moving, causing internal bleeding and severe tissue damage. Any sudden movement could have ruptured vital organs. Surgeons had to sedate the patient deeply and remove the eel slowly to prevent fatal injury. Doctors later admitted the unpredictability of the animal made the surgery extremely dangerous. It is considered one of the most bizarre emergency procedures ever performed at that hospital. A man came to the hospital after a minor fall. He appeared stable, alert, and responsive. Doctors ordered a precautionary scan. What they found was impossible. A metal fork was embedded inside his skull, penetrating dangerously close to critical brain tissue. The patient had no memory of how it got there. Doctors believe the object entered through the eye socket years earlier, possibly during an accident or assault. Remarkably, the brain had adapted around the foreign object, preventing immediate fatal damage. Neurosurgeons carefully removed the fork, millimeter by millimeter. The patient survived with minimal neurological impairment. A young child arrived at the emergency room with vomiting, severe pain, and abdominal swelling. X-rays revealed hundreds of small magnets stuck together inside the intestines. Magnets are extremely dangerous when swallowed because they attract each other through intestinal walls, causing tissue death and perforation. Surgeons performed a multi-hour emergency operation to remove them. Doctors stated that if surgery had been delayed even slightly, the child would not have survived. The human body can survive the unimaginable, but it never forgets what it's forced to endure. If this video shocked you, it's because every case was real. And somewhere, doctors are still uncovering things they never expected to find. Thank you for watching. Please like and subscribe.